Good morning, Jennifer Levine from Jennmed. Thank you so much for coming to my page, coming to you today from my car on this Monday morning. I wanted to make a quick video today about what to expect with your urinary patterns after a prostatectomy for prostate cancer surgery. Now, I always say everybody is a little different, but in general, everybody has some degree of urinary leakage or urinary incontinence after prostate removal for prostate cancer surgery. That's when the Kegel exercises and the strengthening the pelvic floor come into play. But a lot of times the bladder has to accommodate to a new environment, meaning that there is no longer a prostate that the bladder has to kind of squeeze and push through to push the urine through. So sometimes after prostate removal, some men can have some degree of overactive bladder for a little bit after surgery. It's important obviously to assess for infection because overactive bladder symptoms can also indicate infection, and it's important to get a sample if you think any kind of infection is present. But sometimes there is some degree of overactive bladder, and you just have to train the bladder because it is in a new environment. It doesn't have a prostate gland there anymore. So again, it's important to know how you were pre-operatively. A lot of patients were on a medication that we commonly use called tamsulosin or Flomax, and this medication is no longer needed after prostate cancer surgery because there no longer is a prostate. So a lot of people are wondering about that medication, if they have to continue that after surgery, and the answer is no. Obviously, check with your physician, but most men do not need to continue Flomax or tamsulosin after prostate cancer surgery. I hope this brief video helps you. I am Jennifer Levine. I am creating an online space called Jennmed, which I'm hoping that will provide education, support, and community. Thank you so much for listening, and I hope you have a wonderful day. Take care. Bye-bye.